Here in Studio A this morning with my guest, as I mentioned, from San Juan Regional Medical Center. We are talking about Stroke Awareness Month during the month of May. Dr. Carletta Thompson is my guest this morning. Good morning and welcome back to KSJE.
Good morning, Scott. Thank you for having me.
You bet. Nice to have you here. As I mentioned, the month of May is Stroke Awareness Month. You are in charge of the stroke program at San Juan Regional Medical Center, the medical director, and you're here to talk a little bit about the warning signs of stroke and some of the things that then can be done for patients maybe who have suffered a stroke and more. So let's get right to it. What are some of the things we should be watching for when it comes to strokes?
Well, the first thing we want to understand is what a stroke is.
Okay.
So,
Right.
like a heart attack, where you have loss of blood flow to the heart, the stroke is a brain attack. It happens when there's loss of blood flow to your brain, and that causes problems with any function in your body that the brain controls, which is everything.
Right. And so that causes damage, I guess, right? If it's lost for too long.
Correct. And so we want to know what to look for so that you can get help as soon as possible.
Got it. What should we look for?
So there's a mnemonic, be fast.
Okay.
It means that you can look for problems with balance, problems with your eyes, so any kind of visual changes, seeing blurry things, things going dark or going narrow. Fast, face, you can lose movement in your face or your face will start to droop. A for arm, you can have weakness in your arm, difficulty to control movements in your arm, or feeling numb or tingly in your arm. S, speech, you can lose the ability to say words, lose the ability to get words out of your brain, like you'll be thinking you're saying something and it comes out garbled or the wrong way. And then most important, T for time. When any of those things are happening to you, it is very important to get to the emergency room as soon as possible because time is brain. The sooner you get to medical attention, the sooner we can assess if you're having a stroke, and the sooner you can get treatment.
Got it. Be fast.
Yes.
Is that word letters to remember? And so I was going to ask you, and you kind of mentioned a little bit about it. Does the person maybe suffering the stroke realize maybe that they're suffering from some of these things? Or you mentioned that maybe the speech, it's maybe they think they're saying something that makes sense, but maybe the people around them are like, I don't know what you're talking about.
So both things are possible. When you're having the symptoms, most people can understand if they're feeling dizzy or
Sure.
they're losing their balance or they try to pick up their arm and it doesn't work. But you're exactly right. If one of the first symptoms are your inability to speak, you may not recognize that. And so the people around you will have to recognize that.
Okay, because you're thinking you're saying the words as you want to,
Yes.
and the folks around you, it's not making sense to them.
Correct.
And so that's important to know. And strokes are kind of and I don't want to say, well, I guess I will say, an equal opportunity thing, right? Because both men and women can suffer strokes. Is there any one sex that has more strokes than another?
In general, strokes happen between both men and women. Stroke is one of the third leading causes of death in women, and so it's very important that women recognize that they are also at risk for stroke. And there are some risk factors that are specifically associated with women that can increase your risk for stroke as well.
Got you. But those same be fast symptoms or things to worry about
Yes.
affect both men and women, I guess.
Yes.
So that's important to know, too. And some of the other things, I guess, are some contributing factors to the preponderance to have a stroke, perhaps, right, for individuals?
Yes, there are risk factors that we need to be aware of that increase our possibility of having a stroke. That includes smoking, obesity, medical conditions such as high blood pressure, high cholesterol, and diabetes. And unfortunately, the one thing that affects us all is our age. As we get older, our risk of stroke definitely increases.
Got you. But now some of those things we can do something about. Can't do anything about the aging part, but the other things, though, there are some
Yes.
things we can do, correct?
Yes.
Obviously.
For example, we can work hardest to quit smoking. We can make sure that we try and do the best to have an appropriate diet. If we have the diseases, high blood pressure, high cholesterol, or diabetes, that we follow up with our medical providers and get treatment and manage those diseases as best possible.
Right. And that's important as well. And so, with that being the case, it sounds like there's a lot of folks walking around that have some of these high risk factors for stroke, which is obviously why you're here this month to talk about these things, so that folks are aware maybe of some of these things, and that the hospital has someone in place, you, that can help someone if they've had a stroke to recover from a stroke, because maybe not a lot of times, but many times, I think folks who've suffered a stroke can regain part of what is lost or all of what is lost. Is that a true statement?
So the best thing you can do is, if you have any of the symptoms we discussed, that you make it to the emergency room as soon as possible, because that puts you at the ability to receive the treatment for stroke, which are medications that can break up that blood clot that happens to have caused the loss of blood flow to your brain, the clot busting medications.
Right.
And we give those IV in the emergency room at San Juan Regional Medical Center to try and break up that clot. And if we get that clot broken up in a fast amount of time, then the blood flow can resume to the brain, and then that gives you a better chance of not having long-term deficits from the stroke.
Got you. And that's important. And that's why time is such an important part of that
Yes.
BFAST memory device that you've shared with us, because
Yes.
that's important, because time, as you told me this morning before we came on the air, equals brain in
Yes,
this
it
case,
does.
right? And so the more time that blood is not getting to that part of the brain, the more damage that is being caused. And I guess it just depends on what part of the brain we're talking about, that then determines what thing you've lost or what damage is done. And that's why strokes can impact different people differently.
That is correct. Whatever blood vessel in the brain is the one that's blocked off and loses blood flow, that determines the specific injury you may have from the stroke, whether it's loss of your vision, loss of your speech, just loss of function of your arm or leg. That is determined by the location of the blood vessel that loses the blood flow.
Got it. And sometimes I think folks have heard or from folks who maybe suffered a stroke that it has impacted maybe one side of their body more than another side, and that's again dependent on the brain and the part of the brain that's affected.
Yes, the way the brain works in general is that the things on the right side of your brain control the things on the left side of your brain, and the things on the left side of your brain control the things on your right side of your brain. So
You mean
right of your body.
Body.
Correct. Thank you.
But it's opposite. So
yes, and
got
so
it.
if the blood flow loss is to an area on the right side of your brain, then typically you will lose the function on the left side of your body.
In some area, perhaps, or the whole left side, perhaps,
Well, it
too.
depends again on the exact location, but generally, injury to the right side of the brain causes damage to the left side of the body, and vice versa.
Got it. Very interesting. And so, depending, of course, on how severe that is where I guess you come in with your patients and the work that you do to help restore some of that loss, right?
Yes, I am also the medical director of the San Juan Regional Medical Center Inpatient Rehab Unit, and that is where we help with people who have had severe injuries from the stroke move toward recovery.
Got it. And so talk to me a little bit about what some of those things might be. Obviously, let's say loss of movement in my arm or my leg. Is that something that can maybe come back pretty well?
Yes, at the inpatient rehab unit, the patients will be treated by dedicated rehab nurses, physical therapists, occupational therapists, and speech therapists. And there we will working on teaching them how to use the part of the body that was not affected properly, while we also work to engage the part of the body that was damaged to try and regain function.
Got it. And in many cases, is it usually just one thing, or could it be multiple things that I have lost?
Quite often it is multiple things. So you will lose the ability to move your arm and leg. You may also have changes with your ability to see or perceive images, or how the images are perceived. You may also lose your ability to speak or understand what is spoken to you. You may also just have a little bit of difficulty processing or putting things together, so that it's a little foggier or slower how you understand or process things. And all of those things can happen.
Got it. And all those things, I guess there are maybe some possible treatments for as well.
Yes, and so when you have found to have deficits from the stroke, then we implore lots of different treatments to try and engage your arm or leg to get their movement back, to teach you how to form words or understand words, teach you how to, as I said, use tools to help you if the strength doesn't come back all the way, how to use tools to help you be able to do things. We also work if you need training on how to incorporate the side you weren't used to doing. For example, if you were right-handed and your right side is more effective, we teach you how to do things with your left side, or different ways to do things to allow you to be able to function. We also give you strategies to help enhance the healing as it happens. But really, the most important thing we explain to our patients is that it takes time to heal, and so we have to let that time happen.
Right, and I guess that can be maybe a tough sell for someone who wants to get back to
Yes.
the lifestyle they had before the stroke, and so that can be a process.
Yes, it is definitely a process.
And so when folks are going through some of this rehabilitation work, is it, again, even though it's about time, is there a certain amount of time, or after maybe 6 months or so, maybe that's about as much as they're going to get back, and then you have to start talking about living with this?
Actually, the brain takes a long time to heal, and so we tell patients that usually the quickest form of healing happens within the first 3 months after the stroke, but the healing process takes a long time, and so that you can be getting returned back from your stroke a year, 18 months after the stroke.
Even that longer?
Yes.
Interesting. The brain is fascinating, isn't it? I
Yes.
mean, it really is about what it can do and how resilient it can be in some cases, and I imagine
That is
every
correct.
case is unique and different, so it's hard to make blanket statements, but for some of these patients, so I imagine it is very encouraging to know that maybe they can get back some of what was lost, or maybe all of what was lost in some cases.
Yes, as I said. And the most important thing to allow you to potentially get all of it back is to get to the emergency room as soon as you may have any symptoms. It is much better to go through the emergency room with concern and be told, oh no, this was not a stroke, than to be at home and have more severe deficits from the stroke and not be able to get the clot busting medicine if you take too long to come.
Very true, very true, and that's an important thing to mention. And I would say too that the trained paramedics and EMTs can also maybe radio in some of that information to the ER, so when you arrive, they are ready to go.
So if you get the symptoms we discussed in the Be Fast, then you should definitely call 911. Our San Juan Regional Medical Center affiliated EMTs are very well trained about how to handle neurologic concerns and stroke, and they can submit a stroke alert to the emergency room, so they will be prepared and expecting you so that we can move forward with your assessment as quickly as possible. And if you are an appropriate candidate for the clot busting medications, you will receive them quickly.
Right, and because they're ready, they're alerted and ready to go while you're still on the road, perhaps en route to the hospital, and that's why that can be so instrumental, I guess, in your recovery.
Yes.
As we talk about time, right? That's an important part of it.
Yes.
So very, very good. Also, we were talking this morning before we came on the air, Dr. Thompson, a little bit about some of the other impacts of a stroke and some of the things that can be done for patients, which is even if maybe a stroke has impacted vision, and there are some treatments and some rehabilitation for maybe some vision impacts as well.
Yes, there are some strategies that the therapist can employ to try and decrease some of the visual spatial symptoms that can happen from a stroke. Often people get a blurry vision. They have difficulty seeing on one side of the other of their eye, coordinating and converging visual pictures. Depth perception is often impacted, and so there are some tools and strategies and things that we can do to try to help that return.
Right, and you also work with a lot of occupational therapists and physical therapists and things like that as well, because there are also different things that maybe need to be relearned by patients.
Yes, as I said, not only our inpatient rehab unit, but we also have the team in our outpatient program. We have dedicated occupational therapists, physical therapists, and speech therapists. And they work with the patients individually to try and improve the deficit that they specifically have. And in our inpatient unit, they receive those therapies coordinated throughout the day, typically 3 hours. And then if they transition to our outpatient program, they will have those therapies on an outpatient basis several times a week to continue with their healing process.
Got you. And this is so important, I think, to talk about that these services are available here and not 180 miles from here or somewhere even further right from here. It's really important that the hospital has gathered all these professionals together, including yourself, to be able to offer these things for these patients that are coming in.
Yes, we have our dedicated emergency room treatment with we're starting the first responders. You see it first, the treatment you receive in the emergency room, dedicated physicians that may be necessary to see you, our neurologists, our neurosurgeons, our hospitalists will be taking care of you. Then if you transition to our next level of care would be the inpatient rehab if necessary for you, and then you would see our dedicated rehab nurses, our inpatient occupational, physical, and speech therapists, myself. And then if for your next continued healing, you may see our outpatient therapist, again, our dedicated occupational and physical and speech therapists in our outpatient program. And so we also have community support groups. As you know, the hospital has a website where community members can get information about how to manage things after a stroke or what to do if they have the symptoms we talked about. I definitely want the community to know that the hospital is here for all levels that they need, whether that's just information or if something happens, what to do, and to also support their family members as well.
That was going to be my next question. You're reading my mind about support for caregivers, family members, spouses, things along that line.
Yes.
I imagine that's a really important part of both the healing and recovery process and maybe getting more positive outcomes, or if the family's on board too.
Yes, it is very important. You start off initially, if something happens, that we educate the family about the treatment options. We engage them to make sure that everyone's on board about what's the plan. If they move into the next level of recovery, we talk about what expectations are, how they can assist them, how they can allow the family member to do things on their own, but where and how to help them. Then as we move on, we talk about the long-term recovery process. We talk about what other next levels of care they may need. Also to help with caregivers understanding that, yes, you are caregivers, but you also need to take care of yourself in order to be a good caregiver.
Right. Very true. Very true. My guest this morning, Dr. Carletta Thompson, is here. She is the medical director for the stroke program at San Juan Regional Medical Center. I'm going to just rearrange your microphone there a little bit and bring it back over like that, and we'll continue our conversation here about the stroke program and the recovery program at San Juan Regional Medical Center. And I know we're talking a lot about the patients that have suffered a stroke and that are in treatment. Again, I think we should let folks know that there's also the chance that a stroke could be fatal if it's severe enough.
Yes, unfortunately, you can have a large enough stroke that it can cause death, which is, again, why we stress very importantly, if you have any symptoms at all that are concerning for stroke, that you call 911 and get to the emergency room as soon as possible.
Right. I mean, that's another really important thing, as we've been talking about this morning. But then again, those risk factors, if you have a chance to call 911, and for some people, I imagine maybe they don't. A stroke can attack and they could be dead, killed by the stroke.
Well, Scott, unfortunately, we don't want to talk about those
I
circumstances.
know we don't.
Because unfortunately, yes,
but it is a possibility.
Can be severe enough, large enough, and happen fast enough that unfortunately it can kill you instantly. But our goal is to educate people about the signs and symptoms that you can see, that you recognize them, and that you call 911 right away to get medical services as soon as possible so that you can be assessed. And if a stroke is happening, that you are able to get the clot-busting medications that are available at San Juan Regional Medical Center Emergency Room to prevent, hopefully, any devastating effects from any potential strokes.
Right. Very true. And of course, there are a lot of success stories from that program and from the work that you all do to be able to get folks into the emergency room and into those medications, whatever that may be, and then into the treatment and the rehabilitation after the fact. And so that's a big, important part of this story.
Yes, it is.
And so that's what we want to talk about. You're exactly right. And, leave it to the media to go negative, right? And so I don't want to leave it there. But I think that it is to leave it on a more positive note about all the families that do have family members that have suffered a stroke and that have gotten a lot of their life back because of what we're talking about, either the medication or both the medication and the rehabilitation skills to learn how to walk again, use their arm, whatever was lost, that maybe they get that back, if not 100%, to maybe a good percentage that they can resume their life.
Yes, you're exactly right, Scott. Every day I have patients who I can see them improve. I see them understanding that they can get their lives back and that they can have a successful life after a stroke. And that's very important.
Right. And I think that's an important thing to remind folks about. And again, a lot of the work, as you mentioned, it does take time. And so, as I said, a lot of patients may be a little frustrated because they're not back 100% the very next day. But I imagine when they can see small improvements, that's got to be encouraging to them
It
to
is.
keep that work going,
It
even though
is.
they think it's really hard and frustrating and difficult.
Yes, Scott. Unfortunately, sometimes when you have a stroke, it becomes overwhelming and overwhelming emotionally, and some people can go into a mild depression. But we encourage them, and then they can see one small recovery. Earlier that week, they couldn't stand, and now they can stand. They couldn't move their hand, and now they can move their hand. And those small increments of healing inspire people to continue to work hard, and they continue to see successes. And that's what our hope is.
Right. And all of that is, again, I guess, again, as the brain heals, as you mentioned, and that may take time as well. But as the muscles heal and that muscle memory, I guess, is healing, and those connections, those neurological connections are restored. All of that is what's happening during this process. And I'm no doctor, so please correct me if I'm way off.
That is correct. When the stroke happens and you lose the blood flow to the brain, a lot of inflammation happens, not only the lack of oxygen and nutrients to the brain, and that's what causes the damage that it leads to the impaired function.
Right.
When we get the blood flow circulating back, usually by the clot busting medications, if you are unfortunately not in time enough to be a candidate for that medication, the body also slowly breaks down that clot over time so that the blood flow can slowly return. As that happens, the blood and the brain materials in that area get the oxygen and nutrients they want, and then the neurons start to heal, and then that happens to cause the return of function over time. And the rehabilitation helps by encouraging the brain to relearn that activity and to get the connections back, or to help another area of the brain take over that function by practicing certain tasks in a certain way. And that's what the rehabilitation team does.
Got it. And that's another thing that why the brain is so fascinating, right? Because if maybe one section is so damaged that maybe it can't come back 100%, there's maybe another part of the brain that can say, you know what, maybe I can do that. As this person is learning how to move their arm again, maybe now it's a different part of the brain that's now handling that motor function than was before the stroke.
Yes, then there is, fortunate for us, some redundancy in the brain.
That's a good thing. I wish more of my friends had that redundancy in the brain, but that's a different show with a different guest, and so that's all right. But it's just fascinating of what I think the human body can do
Yes.
after a stroke and after some of these things. And so you said it too, that you see it every day in your patients when they come back, and from where they started to where they are, it's got to be very fulfilling for you and your staff to see some of these things in your patients.
Yes, it is.
That's wonderful. And we talked a little bit about age being a contributing factor, but there are younger folks who are suffering from strokes too, and I don't think we should leave that out of our conversation.
Yes, it is important that everyone realize that if you have any of these symptoms, that it can happen to anyone, unfortunately. And so if you notice vision changes, if you have a severe headache, if you notice an inability to move your arm or leg, or you have inability to speak, that you should seek medical treatment right away. No matter how old you are, you're not too young to have a stroke. You have to recognize that that's a serious possibility and that you need to get medical treatment as soon as possible.
Very important advice, I think, too, because again, if someone's in their 20s or 30s or even 40s and think, I'm too young to have a stroke, they may not be too young to have a stroke.
That's correct.
And so these warning signs are out there for a reason, to remind folks that is kind of the things to be watching for and being aware of. I'll ask you to maybe repeat that before we go off the air this morning to remind folks what to be watching for. And so if you wouldn't mind, one more time, those letters and what they mean.
So we want people to be fast. So be aware of balance problems, your eyes, any visual changes, any blurriness, any trouble seeing, having your vision narrow off or get dark. Fast face, any difficulty with your face losing strength or ability to control it or drooping. Arm, any difficulty moving your arm, noticing heaviness, numbness, or tingling in your arm, or decreased coordination where you might try to pick something up and drop it. S for speech, any loss of ability to say words or understand words or form words. And then the most important T, time. Time is brain. If any of those symptoms are happening to you, call 911 and seek medical attention right away.
Very good advice. Very good. Dr. Thompson, it's always wonderful to have you here on the show. We are out of time, I'm afraid, but it is Stroke Awareness Month during the month of May, so I hope folks will share this program with their friends and maybe think about these things, the Be Fast technique, all the other 11 months of the year, because strokes can happen at any time,
Yes,
not just
they
during the
can.
month of May. So it's really important to get the message out, and we've done that this morning. Thank you so much.
Thank you, Scott, for having me, and you have a good day.
You too. Thank you very much. Dr. Carletta Thompson, my guest this morning right here on KSJE.